Hi, I'm Dr. Keshika Kurala, MD, Radiology. Today is the second of the discussion series of radiology core exams. Let's begin. Which of the following match of Salter-Harris classification is correct? Type 1 involves epiphysis only. Type 2 involves the metaphysis. Type 3 involves the metaphysis and epiphysis. Type 4 involves the physis only. Now, for board exams and core exams, I urge you to go through Salter-Harris classification once prior to taking your tests. It's high yield. The answer is that type 2 involves the metaphysis. There's a common mnemonic Salter, S meaning straight across the physis. A is above the physis, involving metaphysis. L is lower, that is below the physis, to involve epiphysis. T is through and through, involves metaphysis, physis, and epiphysis. And 5, type 5, is rammed, which involves all of the above. The next question. Which of the following is true regarding the images provided? More common on the medial side, associated with ACL tear, may present with double PCL sign, all of the above. So we've been provided with coronal as well as sagittal PD fat-sat images of knee. There's well demonstrated bucket handle tear of lateral meniscus with a double ACL sign, as we can see. Bucket handle tears are more commonly seen on the medial meniscus, and they are associated with ACL tears, we know, or ACL reconstructed knees. They can also present with joint locking clinically, and bucket handle tears of medial meniscus present with double PCL sign. Therefore, my answer is all of the above. Knee injuries, meniscus injuries, ligament injuries, collateral ligament injuries, high yield for board exams, high yield for core exams. I also ask you to go through the signs once. Okay. Which of the following lung diseases has decreased lung volumes? Transient tachypnea of newborn, meconium aspiration syndrome, respiratory distress syndrome, and pneumonia. It is rather important to be able to interpret the pediatric chest radiographs for the core exams as well as in your general radiology practice. One of the first things which has to be noted is lung volume, right? So transient tachypnea of newborn, pneumonia, and meconium aspiration syndrome all will present with increased lung volumes. See, transient tachypnea of newborn, it is because of the fluid that has not been squeezed because normally of cesarean section inside the lungs, therefore presents with increased lung volumes. Pneumonia will present with increased lung volumes because of inflammation, sometimes because of pleural effusion. In meconium aspiration syndrome, the aspirated meconium will serve as a one-way valve, leading to entrapment of air within the lungs, but does not assist in its expiration, therefore will cause increased lung volumes. Therefore, my best bet is respiratory distress syndrome, which presents with decreased lung volumes because of decreased amount of surfactant, sometimes quantitative, sometimes qualitative, but your lung volume is reduced. The other thing to be kept in mind is TTN in transient tachypnea of newborn. Sometimes the lung volumes may be normal, but mostly presents with increased lung volume. All right. So the answer is respiratory distress syndrome. Which of the following is associated with pediatric retinoblastoma? RB is high yield, pineoblastoma, RB gene dysfunction, osteosarcoma, All of the above. I would go for all of the above. Right. Do you know why? Retinoblastoma is the most common intraocular neoplasm of childhood. As you can remember from your step 1 exams, they can be sporadic or from a germline mutation in the retinoblastoma tumor suppressor gene, that is RB, right? Now, patients with germline mutation in RB are at increased risk for trilateral retinoblastoma, which is retinoblastoma, pineoblastoma, and osteosarcoma. Trilateral retinoblastoma. There are two common kinds of trilateral retinoblastomas that they want you to test with. Sometimes you're provided with the options of bilateral retinoblastoma with pineoblastoma, or sometimes in your options you're provided with retinoblastoma, pineoblastoma, and osteosarcoma. Both of these answers seem correct. Naming seems correct. But nonetheless, the thing to be kept in mind is that if there's germline mutation in RB, then the patient is at increased risk of pineoblastoma, osteosarcoma, and retinoblastoma. And as a point of trivia, a retinoblastoma protein, which is encoded by RB1 gene, is located on chromosome number 13, right? And it is also important to note that retinoblastoma is also a small round blue cell tumor, and patients with hereditary retinoblastoma, whether they are treated by radiation or not, they are at increased risk of developing osteosarcomas as secondary malignancies. Okay, sometimes you may have been taught that because retinoblastomas are treated by radiation, the patients are at increased risk of developing osteosarcoma, and that may not be the case because the germline mutations are also associated with increased risk of osteosarcoma production, risk of secondary osteosarcoma. And when there's a secondary osteosarcoma, it is rather fulminant than the primary one. And the patients with retinoblastomas are also at increased risk of developing melanomas. Okay, also at increased risk of developing melanomas. Next question. Tetralosia Fallot is associated with which of the following syndromes? DiGeorge syndrome, Klinefelter's syndrome, Turner's syndrome, all of the above. So the answer is DiGeorge syndrome. DiGeorge syndrome is a really low yield for core exam, as high yield it was for your step 1 exams. It's not that high yield. However, Tetralosia Fallot is high yield, and it's important to know that it is associated with DiGeorge syndrome. You can remember from USMLE step 1 exams, the mnemonic of catch-22 may be useful. Catch-22 CATCH, catch-22, C for congenital heart diseases like Tetralosia Fallot or conotroncal anomalies. A is abnormal facies of hypertelorism. T is thymic hypoplasia or aplasia. C is cleft palate. H is hypoparathyroidism, and 22 is deletion on chromosome number 22. So DiGeorge is associated with catch-22. C on the catch-22 is congenital heart disease, conotroncal anomalies like Tetralosia Fallot. All right, that's it for today. Tomorrow, we'll come up with more questions discussing core exams. Thank you.